with you. Get your
Doctor, we are
couch
live.
ready.
Doctor, we are live. You can start the session.
Okay, stop sharing. So, welcome, friends, to this all pan-India intercollegiate quiz. This was initiated by Brain Teaser team in association with Ophthalmological Society of Nagpur, and it is called the Big Q. So, this is the famous signature tune of Brain Teasers, just for you.
आठ समंदर अपना अंबर
Sir,
खोज ले अब तू
we
अपने
started
दम
for all
पर
India.
फूक मार के धूल झाड़ ले छोड़ छाड़ के सारे छप्पर आठ समंदर अपना अंबर खोज ले अब तू अपने दम पर फूक मार के धूल झाड़ ले छोड़ छाड़ के सारे छप्पर खोल दे पर खोल दे पर खोल दे पर खोल दे पर बंद घड़ी की भी रुकी हुई सुई होती सही दो दफा चुप क्यों है रहना मन का तू कहना रोके चाहे हिचकियां खोल दे पर खोल दे पर खोल दे पर
So, good evening, friends, and welcome you all to this final of Big Q in its third season. Just for the information of our special guests and few people who have logged in today for the first time, Brain Teaser is an online platform for hosting quiz for all ophthalmologists of our country, and we have been doing it since last 5 years. And Big Q is the baby of Brain Teasers again, and this was initiated for postgraduates across the country, and it was for the first time 3 years back we initiated Big Q in our country for all postgraduates. In its third season, which began in the month of October 2023, we had 8 preliminary rounds, 4 quarterfinals, 2 semifinals, and today is the final. These episodes were taken on alternate Wednesdays at 8 p.m. and we had initially 300 plus teams who participated from various institutes across the country. Today, we have the privilege of having who's who in ophthalmology and our AIS office bearers to witness the finals and also to congratulate these young brains at the conclusion. Let me take this opportunity to welcome Dr. Samar Basak, President All India Ophthalmological Society, Dr. Partha Bishwas, President-elect, All India Ophthalmological Society, and Dr. Jeevan Titiyal, who is a Vice President of All India Ophthalmological Society, and most importantly is also the Chief of prestigious RP Center, Delhi. Also, we have other guests, Dr. Santosh Sonavar, who is the Secretary of All India Ophthalmological Society, Dr. Namrata Sharma, Chairman Scientific Committee, Dr. Vanati, Editor General, and Krishna Prasad Kudlu, Editor Proceedings of All India Society. So, friends, so postgraduates, these all OAS dignitaries will be there to witness how you perform and also to congratulate and also to boost up your morale. Brain Teaser is extremely thankful to the team of quiz masters who have toiled hard to create a wonderful experience of learning with fun. For today's episode, let me welcome Dr. Parthupratim Datta Muzamdar, who is a senior consultant in Department of Uvea and Intraocular Inflammation in Medical Research Foundation, that is Shankar Nethralaya, Chennai. The second quiz master is a dear friend of mine, Dr. Rashmin Gandhi, who is a consultant neuro-ophthalmologist at Center of Sight from Hyderabad, and our own veteran quizmaster, Dr. Uma Kulkarni, who is a professor ophthalmology at Yenopoya Medical College. As we are all aware, such mega projects are not possible without a strong financial support from pharma. Microvision has been our steadfast partner since last 3 seasons for Big Q. Our sincere most gratitude goes to Mr. Ashokan, Mr. Kumaran, Mr. Navneet, and all the field force of Microvision for their steadfast support. We should also thank Mr. Sai and his Numerotech team for smooth and flawless execution of this quiz, computing results, and other back-end work which goes behind every episode. So, without much ado, now I request Dr. Shilpi to go ahead with familiarizing all the participants with the rules of today. Before we have it, yeah. Have you shared? Can you see the screen? Yeah. So these are the quiz masters for today. And Dr. Shilpi, over to you. She will introduce as well and the prizes. Yeah. Let me also, before Shilpi takes over, let me announce the prizes for the finalists for today. Remember, there are 6 prizes and all courtesy goes to Microvision team. The team which comes on 6th number will get a prize voucher of rupees 5,000. Team number 5 gets 10,000 rupees. Team number 4 gets 15,000 rupees and third prize is 20,000. The first runner-up gets a whopping sum of 30,000 and the winner today is going to carry away 50,000. But team number 7 to 10 don't get discouraged. We also have gift hampers for having made an effort to be amongst the top finalists. Also, for all the mentors of winning 6 teams, there is a prize voucher of rupees 15,000 rupees. And team number 7 to team 10, they're meant to get a surprise gift voucher to carry forward the further proceedings.
Hello friends, welcome back. So today is the finals of Big Q Season 3. So let me announce the audience prizes before we move ahead. So for audiences, we have 3 prizes as usual. So it is 5,000 for the winner, then 3,000 and 2,000 rupees for the third place. And now this is a promo from the Microvision team.
Madam, it's not visible. Yeah.
Can you
Okay.
see now?
No, it's not coming, sir. Mr. Sai, can you just check it?
Madam, the screen is not shared.
Yeah.
Okay.
One minute. Yes. Yeah, okay.
So let us see quickly the rules and the format of today's finals. So for teams, you have to log in through 2 devices, that is Kahoot and Zoom. So first screen is the live quizzing screen on the Zoom platform. Today we have 4 rounds. So 3 out of the 4 rounds will be face-to-face. That will be only played by the teams. While the second screen is the Kahoot platform for the MCQ round, which is both for the audiences and the teams. So for now coming to the rules, as you all are aware, MCQs, each set has 5 questions and there will be no negative marking and you will get 10 seconds to answer every MCQ. The other round is the rapid fire round only for the teams on the Zoom platform. In that you need to answer 5 questions in 30 seconds time. For every correct response, you will get plus 10 and for every incorrect, there will be minus 5. Third round will be the image-based round or the case-based. That is also only for the teams. So you will have to answer 3 questions in 20 seconds again negative marking will be there. And the fourth is the sub-speciality round, which is only added for the finals. In that, you'll have to answer 5 questions in 30 seconds time. But yes, there is no negative marking in this round. So now quickly, let us see what is the sample question of today so that you can check your Kahoot whether it is working properly or not. So the first question is, who is the most likely to replace Dravid as Indian cricket team head coach? Your options are A. Amol Muzumdar, B. Gautam Gambhir, C. Ravi Shastri, or D. Sachin Tendulkar. And your time starts now. So time is up. And the correct answer is option B. Gautam Gambhir is likely to replace Dravid. So with this, we start with the first MCQ round with Dr. Uma ma'am. So I welcome Uma ma'am for the same.
Thank you. All the best to all the teams.
So shall we start, ma'am?
Yes. So this is MCQ 1.1. Which of the following with the Austrian ophthalmologist Ernst Fuchs? Option A form of corneal endothelial dystrophy. Option B, a form of anterior uveitis. Option C, the triad of angle closure glaucoma. Option D, infiltrates at the leading edge of a pterygium. Your time starts now. Time is up. So the answer is C, the triad of angle closure glaucoma, which is associated with the name of O. Can we go to the next question? This is MCQ 1.2, and the question is, what is the mechanism of action of repabimide in the management of dry eye? Option A is it's a mucolytic. Option B, it's a mucin secretagogue. Option C, it's an anti-inflammatory drug. Option D, it acts on matrix metalloproteinases. Your time starts now. Time is up. Let's see the answer. The answer is B. It's a mucin secretagogue. Going to the next question, MCQ 1.3. In which method of slit lamp examination are the illumination and the viewing arms held 30 degrees on either side of the central perpendicular? 30 degrees on either side of the central perpendicular. A, retroillumination. Option B, specular reflection. Option C, sclerotic scatter. Option D, indirect focal illumination. Your time starts now. Time is up. And the answer is B, specular reflection. Next question, 1.4. Which of the following stains has antiviral property? It's an easy question. Option A, Alcian blue. Option B, sodium fluorescein. Option C, lissamine green. Option D, rose bengal. Your time starts now. Time is up. Let's see the answer. It's rose Bengal. Go to question 1.5. The question is, name the layer in the retina affected in solar retinopathy. Option A is RP Brooks membrane. Option B is photoreceptor outer segment. Option C, photoreceptor inner segment. And D, outer plexiform layer. Your time starts now. Time is up. And the answer is B, photoreceptor outer segment. All easy questions. Thank you.
Yeah, thank you, ma'am. So with this, we end with the first set of MCQs. Now it's time for Partho sir to take over.
So, hello friends. So, Shilpi will start with the spin.
Yes, sir. So
Yeah.
this will decide which team will have the privilege to select which set they want to play.
Correct. So, good evening, friends. So, best of luck to all the teams. So, let's start with the first spin.
So team 4.
Team 4. Team 4, are you ready?
Yes, sir.
Okay. So, let's see.
So team 4 is team from Arvind Eye Hospital, Coimbatore, that is Spartans of the South.
And the participants are Dr. Krutin Shah and Dr. Chinmay Mahatme, and their proud mentor is Dr. Siddharth Narendran. So, team, are you there with us now?
So just one doubt, actually, in the Zoom and on the mail that we got, ours is team number 5. So
Yes,
I
sir.
just want to clear.
Just
So
clear
we
that.
are team number 4 according to the email that we got.
Yeah, and we were team number 5, sir.
Yeah.
So-
So,
okay,
sorry,
okay.
sorry. Yeah,
Or
correct.
Oro Stars.
Huh.
Okay,
We'll correct it and just move on again. Team 2.0.
so now we'll start with Spartans of South only.
Okay.
Okay.
Let's move.
Okay, ma'am.
Okay.
Well, we'll take set 1 now.
Set
One.
1. Okay.
So, Partho,
Yeah.
over.
So, this is set 1. So, yeah, just open it. Yeah. So, team, here is your question case scenario on the screen. A 3 years old male child was brought by their parents with the complaints of whiteness of the cornea, watering since birth. On examination, the following findings were seen. You can see the photograph?
Yes.
Yeah. So you have to tell us what is the name of the sign.
Ophthalmos.
The question 2,
Congenital glaucoma.
Congenital glaucoma.
and you have to tell me what is the triad associated with the disease. So you have-
Photophobia, watering, and megalocornea.
Blepharospasm.
Yeah.
let's see the answer. Yes, you named it correctly. It's ophthalmos, and the associate disease is congenital glaucoma. And here is the classic triad that associated with the ophthalmos. So let's go to the next spin.
So the answer all correct. So
Yeah.
it is plus 30 to them.
Okay, plus 30.
Which team? Yeah.
Team 5.
So, team 5 is
Now it will be Oro Stars.
okay. Orostas, are you there with us?
Yes, sir.
Dr. Anusha and Dr. Ruhel, both of them from Arvind Eye Hospital, Coimbatore, and their mentor is Dr. D. Chandrasekhar. So now let's move on to the case bed sheet. You have to select the set. Which set
Set
would you
3.
like to play? Set 1
Set
is
3.
what? Set
Okay.
Set
3.
3.
You want.
Set 3.
You want set 3. Okay. So here we begin with the set 3. Over to you, Partho.
Yeah. So, yeah. So here is a question from microbiology. So you have to first describe the organism. Can you describe this photograph?
Gram negative
Yes.
coccobacillus. Yeah. Okay.
Can you tell me this organism, if they produce hypopion, usually what is the color of the hypopion?
Green.
Okay. Now, can you tell us the name of the pigments this organism releases?
Iosine. Iosine. Okay, we have exhausted the time. You have to really look at the watch. You have to be in a hurry to answer. Henceforth, other teams learn from this particular thing. You have 20 seconds within which you have to answer all the questions. So you missed upon. Let us see the answers. Yeah.
So they have correctly answered the first two questions.
Yeah.
And the second one, I think they just answered partially because the time was up.
Yeah.
First, they answered pyocyanin, I think.
Correct. So
Yeah.
I think we can give them
Fine.
whatever the quiz master says. Partho?
Yeah, I think we can give them 25.
Okay.
That's fine. Thank you.
Okay.
Well played, Orostas. Now let's move on to the next team.
Thank you.
So let's see which team now has to come. Okay, team
Team
number one. Team one. Yes, who is the team one? It is from RIO Trivandrum, Dr. Anu and Dr. Gopika Gopakumar. And their proud mentor is Dr. Simon. So team one, are you there with us?
Yes, sir.
Are you ready?
Yes, sir. Yes, sir. Yes, yes.
If you want.
See, one of you have to answer, please. Or don't repeat it.
Okay, sir.
Which set you would like to have played?
Set 10.
Set 10. Okay, let's move on to the set 10. And Partho, over to you.
Yeah. So let's start. Here is your case scenario. You can see here a 60-year-old man presented with sudden profound visual loss in the left eye, which is associated with headache and periocular pain. So the questions are, you have to tell me the diagnosis. This is your first question. If you,
Arthritic AAON.
next,
Giant cell arthritis.
how do you
Giant cell.
describe the first picture?
Dysplasia. Optic disc.
And the second question
Next.
is, what is
Next question.
the Foster Kennedy syndrome?
Optic atrophy in one eye and the discedema in the other eye.
Okay, let's see the answers.
Yeah, I think they could not answer it properly. So let's go to the next pin and next team.
No, how much
So,
do you? I think they answered first part, giant cell arthritis, probably.
Yes, sir. First
Let's
and
see.
last, they
First,
answered.
they answered 10.
Yeah, yes, Dr. Partho.
Yeah, 10. I think 10 marks to them.
So last also they
Last they
answered.
answered, I believe.
Last, I did not hear properly.
Yeah,
They answered.
they
sir.
answered well.
Okay.
Only they
20.
missed upon. So they get 20 probably.
Yeah, 20 marks to them.
Okay, fine. Well played. So now let's see who is the team. Let's move on to the spin. Yeah.
Team two.
Team two. Team two, are you there with us?
Yes, sir.
So Dr. Vasavi and Dr. Sirisha. Okay, and the proud mentor is Dr. Prabhakar Sastri. So best of luck. And let's now it's time for you to select the set.
Set 2, sir.
Okay.
Two.
Okay.
Team two, set two.
That's
Okay.
great. Let's see. No, go back. Set two. Yeah. So Partho with you.
Yeah. So your case scenario is a 45-year-old female presented with complaints of pain in the right eye on and off. Her IOP was 26 millimeter of mercury. On slit lamp examination, you can see the finding here, which is visible on your screen. And your first question is, name the associated syndrome. You see the picture and pick up the diagnosis.
Pain, complaints of pain in right. It's angle closure glaucoma on and off attacks. Maybe.
Okay.
And
Question
in
two
the
is
other part
in the other parts of the eye where it can be seen.
can be other parts of the eye.
I think,
Sir,
yeah, time is up. You can go ahead with the answering the third part, but you will not get the marks for that.
which part of this is
Okay, let's see the answer.
I think you have missed it.
on and off attacks?
The first answer is pseudoexfoliation syndrome. The second is it can be seen in cornea, pupillary margin, and granules, and it is a type of primary open angle.
So I think they answered the first question, but that was wrong. The second and third they couldn't attempt. So I think it goes -5 with them. Okay. So thank you. Now let's move on to which is the next team which is going to play.
5 we have done.
Yeah.
7.
Team 7, Team Macula, that is going to be from Raipur Ames.
Team 7, sir, not set.
Yeah, Team 7, sorry. Back Joe.
5. Sir, set 5.
Acha, this is the team 7 from Ames Raipur. So Dr. Sharmila, Dr. Q, welcome. And their proud mentor is Professor Somen Mishra. So now it is time for you to pick up the case.
Set 5 this.
Set
Yes,
5.
Set 5. Fine.
So set 5, it is a spotter. So you have to tell me the diagnosis.
Pass.
Pass, sir.
Which stain is used for the diagnosis? And
Congoded.
the third is what are the associated features? So naturally, if you can't make the diagnosis, you can't answer.
Pass.
So I think they could not answer. So I think -5. Am I right, Shilpi?
Correct. Very well. So fine, Team Ames. Now let's move on to the next set. Let us see who is the next team which is going to play. Let's have a spin.
Spin.
So it's Team 3. That's from RP Center Ames. Yes, and Dr. Zakir Hussain and Dr. Vidit Bansal are the participants, and the proud mentor is Dr. Namrata Sharma. So, are you there with us?
Yes, sir. Yes, sir.
Yeah.
Which
set would you like to play? The ones in blue are leftovers.
Set 9.
Okay, set 9. Over to you, Partho.
Yes. So team 9. So are you ready?
Yes, sir.
Yeah, because your mentor is also here. So I just this photographs and you have to tell me what is the diagnosis.
Sir, pseudotosis.
Okay. The next is the name the common clinical association of this condition.
BPS associated with ovarian failure. Type 1 ovarian failure. Extreme upgaze. IMRD is a measurement in the extreme upgaze.
Okay, let's see the answers.
The second was, I think, I'm not sure. The first is right. The third also they answered it correctly. I'll give it to them. The third, I think, was, I think they could not answer. So 20 to team 9.
So is it -5 or 0 for the second, sir?
Second will be 0. Yes.
Okay, sir. Okay.
So well played. Now let's move on to the next team. Okay, team 10, Friends from BHU.
So are we audible?
Yeah, so Dr. Kaurav Pandey and Dr. Samvida Parihar from BHU, and the proud mentor is Dr. Deepak Mishra. So let's move on to the case, and the blues are the ones which are left over, set 6, 4, 8, 11. Which one do you want?
Set 4, sir.
Set 4 you would like to go. Okay. Yeah, 1 minute, set 4. Yeah, over to you, Partho.
Yeah. So team, you have to tell me from this photograph, what is your diagnosis?
Pass,
Okay,
sir.
lovely. This next question is what are the type of these lesions? Can describe them
Pass.
here. Okay. So what are the associated features? Naturally, it will be difficult for you to answer if you can't answer the first and second.
Pass.
Okay, let's see the answers.
It's a case of posterior polymorphous corneal dystrophy. So we'll just go to the spin and to the next team.
Okay.
0. Okay.
Okay, team 9. So team 9 is Optic Up. They are from Sankarai Hospital, Dr. Pooja Patil and Dr. Pratik M. And the mentor
Yes,
is
sir.
Vivek. Are you there with us?
Yes, sir.
Okay, now time for you to select the set. 6.
Set
Yes,
set 6, sir.
set 6. Fine. Okay, let's move on to the set 6.
Team 9.
Yeah.
Yeah. So let's fix the 6. Yes. Tim, so you just go through this photograph and you have to identify the organism from this photo.
Pass.
Then what the next question is, what is the stain used in the second picture?
Calcoflower white.
Okay, the third is, what is the technique used for to stain?
Microscopy. Are those acanthophobus?
Is coming in? I'll give it, just tell me.
Immunofluorescence. Acanthophobus.
So I think the first they could not answer, the second was right, and third also they answered it correctly. I just confirmed it.
Later.
The first question we answered the last, sir.
Yes,
The
sir.
last
So they
then
answered
was
the
up.
first question later on before the time is over.
Yeah.
I think
I really doubt about the third answer, but they didn't. You said immunofluorescence?
Yes, sir.
Okay.
Okay, we take it. So you get plus 30. Well played.
Thank you, sir.
So now the only team which is left over is team 8.
नहीं ना, दो हैं. अच्छा.
कौन सी? अच्छा. हाँ, team
6
8
है.
and 6. Sorry. हाँ. Yeah, it is team 8 now. Team 8. So we have Dr. Archana Singh and Priyanka Sonkar from AIMS Raipur, and their mentor is Dr. Madhuri Akela. So Dr. Archana, Priyanka, are you there with us?
Yes, sir. Good evening, sir.
Okay, which set would you like to go with?
I think
So
7 are remaining. 7, 8 and 11 are remaining.
Yeah.
Set 8.
8.
Okay, fine. So with you.
So here is your case scenario. So this boy sustained a closed head injury 4 days ago and developed vertical diplopia. He was found to have a right hypertropia, which increased on the head tilt to the right shoulder. So your questions are, first questions are, what compensatory head posture may he adopt?
Pass.
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 What test is done to evaluate this condition?
Parks test. Three-step Parks test.
What is the named surgical procedure done in this condition?
Hadot procedure.
Yes, come again. Tell me the.
Sir, Harada procedure.
Okay.
Yeah. Show the answer. So what I think first question they could not answer.
Correct.
Second and third they answered.
Yes.
Fine.
So we'll give the two correct answers. So we'll give 30 to them.
Now the only team 6 is remaining.
Team Asta Arun. So Dr. Asta and Arun from Jipmer Pondicherry, and their mentor is Dr. Nirupa Mad. So
set 7 and 11 are remaining.
So 7 and 11, you can select one of them.
So we'll go with set 11.
Okay, fine. So over to you, Partho.
Yeah. So, Tim, here is your question that a 70-year-old male presents with a slowly enlarging Parley nodule with a telangiectasia on the right lower eyelid. So, questions are, what is the most likely diagnosis?
Basal cell carcinoma, sir.
What is the most common site?
Lower lid.
Lower eyelid.
Lower eyelid.
Most common associated syndrome with this condition?
Garland.
Garland syndrome.
Okay, we'll give all the three to them.
Great.
30.
Well played.
Well played, team. I think
So
we're done with this
we end
round.
with the this case-based round. And now it's time for the second set of MCQs. Parthu sir, you.
Yeah.
Yeah. So shall I start the questions?
Yeah, you start. So the first MCQ, the 2.1 is below what CD4 count level usually CMV retinitis seen in immunocompromised patients? Your options are A, less than 100 cells. Option B, and then option C and D. So you have to tell us below what CD4 count level usually CMV retinitis seen in immunocompromised patients. This is the question.
So that.
Let's see the answer. Yes, C is the correct answer. So now, next question. Question is 2.2. Which of the following is not a histopathological risk factor for retinoblastoma? Options are A, retrolaminar invasion. Option B, cataractous lens. Option C, massive choroidal invasion. Option D, iris involvement. The time starts now. Out. So the correct answer is option B. Now let's move on to question number 2.3. Now, what anatomic structure is most commonly involved in orbital blowout fracture? And your options are option A, portion of the orbital floor medial to the infraorbital canal. Option B, portion of the orbital floor lateral to the infraorbital canal. And option C, inferior orbital rim. And option D, infraorbital foramen. Time up. So the correct answer is A, portion of orbital floor medial to the infraorbital canal. Now to MCQ question number 2.4. Which of the following conditions is not associated with HLA-B27 linked acute anterior uveitis? Your time options are Behçet syndrome, option B, psoriatic arthritis, option C, Crohn's disease, option D, Reiter syndrome. And your time starts now. Correct answer is Behçet disease. So let's go to the question number 2.5. What is the most common cause of unilateral childhood proptosis? Another easy one, and your options are capillary hemangioma, option B, optic nerve glioma, option C, orbital cellulitis, option D, thyroid eye disease. And your time starts now. And the correct answer is orbital cellulitis.
So with this, we end with the second round of MCQs, and it is time for a short break. now it's time to declare the winners of the last episode in the private practitioner category. So that is the semi-final 2.
So the practitioners who won were, the phone number is 944514303. Then 8374167672 and 7478179087. So the practitioners who played the semi-final 2, these are the 3 people who have won the prizes. And we will request them to log in at the conclusion of the ceremony or at the conclusion of today's quiz on the Zoom platform. We will be felicitating them with the gift voucher. So now it's time for us to move on with the subspecialty round.
Welcome back, Uma ma'am.
So Uma ma'am.
Ale, coming. Yes.
So let's go. Ma'am, first you please explain the rules.
Okay. The rules are like this. This is a subspecialty round. There are 12 subspecialties in Opthal which you can choose from. Each team will go in one order, 1 to 10. And each team will select one subspecialty. And within that specialty, you will have a crossword-like question. Okay. In this crossword, you will be asked 5 questions. Each question is linked to one alphabet which is visible to you. So make use of that alphabet to identify what is the correct answer for each. So, for example, if the question is complication of diabetic retinopathy. Now, complication of diabetic retinopathy can be many. It can be tractional retinal detachment or clinically significant macular edema or vitreous hemorrhage, so many, right? But you will have to see what is that alphabet there, using which you can insert this word correctly there. So if it starts with V, you know that it is vitreous hemorrhage. Okay, it cannot be tractional retinal detachment. So you can make use of those letters to identify the correct answer. So the idea is not to test your knowledge only. It is also to test your gaming skills. So you just not have to find out the right answer, but the right word that fits into that crossword. Okay. And the second thing is, now say the most prominent word of that answer will be taken. For example, if the answer is, say, shield ulcer, okay, shield ulcer will not be there. The main word, that is shield, is the one which will be spelled out there. It's very easy. Don't worry. You have 5 questions in a sequence. You have to answer in only 30 seconds. There are 10 points for each correct answer. You have to answer within 30 seconds. No negatives, and there's no passing also. Is that clear? Okay. Okay, Shilpi, we can go ahead.
So we again start with the spin, ma'am. Or you
want to use a spin? Yes. No problem. You can choose a spin also. Yes, spin.
Okay. So team 7.
Okay, team 7. Team 7.
Yes, ma'am.
Yeah.
Uveitis.
Team 7 can choose the subspecialty. What do you want to choose?
Uveitis.
Uveitis. Okay. Can we have the questions on uveitis? So before we start the time, I'll just wait here. So these are the letters that you will make use of. U, V, E, I, T are the letters that you will make use of for each of the answers. Okay. Your answers should fit in there. Question number 1 will be for U. Question number 2 will be for V. 3 will be for E, in that same sequence. Okay?
Yes.
Okay, fine. So 10 points for each answer, each correct answer. So can we have the first question?
Yes, ma'am.
Okay. Which is the FDA approved TNF alpha inhibitor for non-infectious uveitis? The second question, you can give your question.
Adalimumab.
Yes, correct answer. This inflammation is common in dengue-associated uveitis. The second one.
Next question.
Retinal arteriolitis. Yes. Question 4. HLA-B29 associated progressive bird shot. I heard it. The last question you couldn't make it. The question is name the new name for Reiter's disease, Reiter's arthritis, because of which the Nazi war crime, his name was removed. Okay. So they get the first one correct. They get the third one correct. And they get the fourth one correct. So they get 3 correct. 3 correct. The second answer, dengue associated, it is foveolitis, and Reiter's is now called reactive. Okay, so they get 30 points there. Very well done.
I hope everyone now understood how to play the round.
Yeah.
So now we
Okay,
So
spin.
spin. And
again.
let's see the team. Team number 2, that is the ophthalm nerds. Dr. Sirisha, Dr. Wasabi, are you ready?
Okay, team 2, are you
Yes,
ready?
sir.
Yeah, what is it that you want to
Yes,
choose?
ma'am. Cornea.
Cornea. Okay.
Be little louder and nearer to the mic, please.
Yeah.
Yes.
Cornea. These are your COREA. Okay. So your first question is, crab claw appearance on corneal topography is seen in?
Marginally.
Yes, you get it right. Antiarrhythmic drug causing cornea verticillata. Very
Amiodarone.
good. Name the red reflex movement of keratoconus.
Scissoring reflex.
Correct.
Scissoring reflex.
One among the two who proposed the classification of scleritis. Okay, last question. The line prominently seen in embryotoxon, posterior embryotoxon.
Schwalb's line.
Yeah,
Schwalb's line.
we give it to you right on dot. You get 4 right. Pellucid is correct. Amiodarone is correct. Scissoring is correct. You didn't get Hyre, Watson and Hyre. And the last one is Schwalbe. You got it right on time. So 40 points to this team.
Well
Very
played.
well done.
Thank you.
Very well played.
Let's move on. Let's see who is the next team. Team number 5.
5.
Yeah. So team 5, that is the Orostas 2, Dr. Anusha and Dr. Rohel Chako. Are
Yeah.
you there with us, Rohel and Anusha?
Yes, sir.
Okay,
Yeah.
best of luck.
What do you want to choose?
You answer.
Neuro-ophthalmology.
Neuro-ophthalmology, my favorite. Okay. Okay. So these are your clues, NEURO. Okay. So the first question for you is, drug used in the diagnosis of Horner syndrome.
Amphetamine.
Sorry, we didn't get you.
Pass.
Okay. Okay, second question. Nucleus for convergence is called?
Pass.
Okay. Third question. Serum or CSF immunoglobulin tested in Devick's disease?
Pass.
Pass. Fourth, the illusion on seeing elliptical movement instead of straight line in optic neuritis?
Pass.
Okay, pass. So you get 1 right. And the second is nucleus of Perlia. Third is aquaporin. Can we have the answers? Yes, aquaporin. Fourth is Pulfrit phenomena. And the last one is anisocoria, which we could not reach. Okay, you get 10 points there.
Yes, ma'am.
Yes.
So now again, time for the spin. Team 5 already done.
Team 5, 7,
Okay.
2. So
Team
team 3. Asal and Le, that's from RP
Okay.
Center, Vidit and Zakir. Are you there with us?
Okay.
Yes, sir. Yes, sir.
Ready?
Okay, are you ready? Okay,
Yes,
what is
sir.
it that you want to choose?
Cornea is gone.
Ready, sir.
Before we start, just
Right.
make sure you are very close to the mic so your answers are heard. Okay?
Yes.
Yeah.
Are you able to hear us, ma'am?
Yeah, great.
Okay, so your questions, clues are RETIN. Okay? So your time starts now and the questions are: membrane formed by hypoplastic retina in retinochoroidal colobomas.
Intercalary membrane.
Very good. Second one, shape of choroidal rupture is described as?
Pass. Wave.
Third question, retinopathy in the case of fracture femur.
Portional.
I heard it right. A stage in Best's dystrophy.
Vitiliform.
Correct. The last question, he described the finding the whole rule in retinal detachment.
Link off.
Yes, you get it. So, did you answer the second question? We couldn't hear you clearly.
No, ma'am.
No. Okay. So they get 4 points. Four correct. And the crescentic was the answer which you missed. Otherwise, you got all of them. Okay. So very good, 40 points to them.
Yes.
Next team.
Team
I think
three.
team three is
done.
over. Sorry, again.
Ah,
Yeah,
10.
team 10.
Okay, team 10.
Dr. Gaurav and Dr. Samvida, are you there with us?
Yes.
Okay. What do you want to choose?
Ocular traumas.
Ocular trauma. Okay, ocular trauma. So your clues are TRAUM. Okay, these are the 5 questions for you. Your time starts now. The first question is, according to bed terms, what is ocular trauma without full thickness eyeball injury called?
Confusion.
Very good. Second question, he lost his eyes to sympathetic ophthalmology. Braille is correct. One of the key determinants in OTS, the long word.
Injury.
Okay, fourth
Pass.
question. Roper
Open
Hall's
classification.
classification of chemical injuries were originally modified from?
Pass.
Pass. Last one, sphincter test, zonular dialysis,
Campbell.
and
Campbell.
yeah, you get it right, I'll give it to you. So you get 3 right. The third answer was endophthalmitis, and Hughes was the 4th answer. Very well done. Three correct answers, 30 points. Next team is?
9.
Team
Team
9.
9, that is optical,
Okay.
Pooja Patil and Pratik.
Yes, sir.
Yes. What do you want to choose?
Cataract.
Cataract. Finally, it has come. I thought the first one to go would be cataract. Okay. So your clues are A, R, C, and T. Okay. Look at that. So your time starts now. And the first question is, first name of the person who introduced phacoemulsification. First name.
Pass.
Second question, pupil dilating device.
Manugan ring.
Very good. Perioperative drug that increases the risk of cystoid macular edema.
Pass.
Okay. Embryological origin of the crystalline lens.
Ectodermal. Surface ectodermal.
It should fit there. Condition associated with bilateral ectopia lentis. Quickly, otherwise you lose it.
Here, homocystinuria.
Okay.
Okay, a little too late, but we give it to you. You have 2 correct answers, Malugan and homocystinuria. The answers are Charles Kellman. So epinephrine is the drug, and lens placode. So what I said is it has to fit there. Even if you say ectoderm, it has to fit there. Okay, so you get 20 points.
20 points.
Thank you.
Yes. Next team, be ready.
2 is done.
Team 2
Three
is
is
done.
Done.
So the spinning increases the adrenaline, I think.
Yeah, team 1. Team RIO, Trivandrum. Dr. Anu and Dr. Gopika.
Okay, sir.
Are you
Okay,
there?
are you ready?
Yes, sir.
What do you choose?
Yes, sir.
Subspecialty.
Glaucoma.
Glaucoma. Okay, glaucoma.
Glaucoma.
Yes. So your clues are LAUOM. Okay, look at that. Your time starts now. And your first question is this: a type of glaucoma with pseudohypopion.
Pass.
Second question: condition in which double hump sign is seen in the iris.
Plato iris syndrome.
Very good. Give it to you. One of the genes linked to glaucoma.
Optinurin.
Yes, give it to you. Goniotomy blade in minimal invasive surgery.
Pass.
Pass. The last question: drug causing angle closure glaucoma. Yes. You still have. You lose the time now. You were saying something.
Tahu.
Yeah. You're late, but you get 30 points there. 30 points. The Kahuk was the one answer which you did not get, and phacolytic glaucoma. Okay, go to spin. Next team.
Team 6.
Okay, team 6.
Yes, ma'am.
What is your choice?
Asta and Arun.
Asta and Arun.
Ocular tumors, sir.
Tumors. Okay. Let's go to ocular tumors. Your clues are TUMOR. Okay, so your time starts now. And your first question is, what is a surgical adjuvant to wide excision in OSSN?
Interferon.
Question number 2. Orange color in choroidal melanoma is due to? Next question. Primary orbital malignancy. Yes, that's one correct answer. One of the intra-arterial or intravitreal drug given in retinoblastoma. No, last question. Photosensitizer used in PDT.
Verteporfin.
Yes, I give it to you. You get 2 answers correct. Rhabdomyosarcoma and verteporfin. The other answers are cryotherapy, lipofuscin, and topotecan. These are the 3 answers you missed. Okay, no problem. Good show.
How many teams remaining?
So 4 and 8.
Are you liking it? Say something.
We are enjoying.
Oh, nice, nice.
Yeah, team 8. Tulip. That is from
Okay.
Dr. Priyanka and Dr. Archana.
Okay.
Yes,
What do you want to choose?
so orbit, ma'am, orbit.
Okay, orbit. We go to orbit. So ORBIT are the clues. Your time starts now. And the first question is most common type of lacrimal. Very good. Before the question, orbital leukemic infiltrates.
Pass.
Pass. Sign of poor convergence. Mobius is right. A bone in the floor of the orbit.
Pass.
Pass. And the last is radiological view of orbital floor. Waters view. You want to take up the other one? Fourth one, bone in the orbit.
Palatine.
Palatine is the correct answer. So the only question you didn't get is chloromas. Orbital leukemic infiltrates, which are chloromas. You get 40 points. Very well done. Very well done.
Thank you.
Only team number 4 is left. Now I think we don't need to go to spin.
Spin.
Yeah. Yes.
Directly. So
you
this
have 3 choices.
4. Spartans of South, Chinmay and Krutin.
We'll take squint. Take squint.
Squint. Okay, well, my favorite again. Let's see, the clues are SQUIN. Okay. So we'll start. Your first question time. Yeah, time. Bow tie or sliding noose are types of what type of suturing in squint surgery?
Pass.
Pass. Homeostatic forceps used in squint surgery.
Mosquito, but
Array. The third one, a method of management of amblyopia.
pass.
Pass. Small squint, peripheral fusion, but central scotoma. Reduced
Microtropia.
Check there. The last one, Huber classified this as type 1. You can attempt it. Yeah, Duen, but you will not get points because we are far away from the time. So did they get the second question right, Mosquito?
We displayed the answer before they.
Okay. Should we give them another choice? Another choice? We have one more set.
Ma'am, we can give +10 for this last question to them.
Okay, fine. That makes it up.
Yeah.
Are you happy, team 5?
Can I want to take another set? Can we take another set, ma'am? Is that okay? Is that okay?
Dr. Shilpi has decided you will get 10 points. Is that okay? Not okay.
Ma'am has decided, no problem.
Shilpi, is that okay?
Ma'am, yes, ma'am.
Okay, so 20 points to them.
Okay.
So the best answers were adjustable and occlusion and monofixation. Okay.
Team 5 and 4, I just want to check with you. In the Kahoot, you have entered as the team names given to you in the during the this email ID, basically through the email ID. Because we need to, collate the marks of the Kahoot also. Team 5, Orostars.
What have you labeled your team on the Kahoot platform? Team 4 and 5. Because we.
Orostars 2.2.
I've labeled it as Spartans Team 5.
Okay, so we will take the name of the team only.
Okay, fine.
Great.
Fine.
So now it's time to go to MCQ set 3. So Uma ma'am.
Uma ma'am?
Yes, I'm here.
Yeah.
I'm ready.
So let's start, ma'am.
Yes. MCQ 3.1. Which fundus structure is used as a guide to compare the size of a drusen? Option A, retinal artery at the disc margin. Option B, retinal artery at the first AV crossing. Option C, retinal vein at the disc margin. And option D, retinal vein at the first AV crossing. Your time starts now. Okay. And what is the answer? Answer is retinal vein at the disc margin. Hope you all got it. The next question, 3.2. What is the origin of Horner's muscle? Option A, levator palpebrae superioris. Option B, orbital septum. Option C, medial palpebral ligament. Option D, lacrimal bone. Your time starts now. Origin of Horner's muscle. And the answer is lacrimal. Don't get confused with the Muller's muscle causing Horner's syndrome. And the answer would have been levator palpebrae superioris. Here the answer is lacrimal bone. Next question is MCQ 3.3. Stage 1 of dysfunctional lens syndrome includes option A, higher order aberrations. Option B, contrast sensitivity loss. Option C, cataract. And option D, presbyopia. Your time starts now. Okay, let's see the answer. The answer is presbyopia. Next question, MCQ 3.4. In the eye bank, as per the biomedical waste disposal, in which color-coded bag should a discarded eye be disposed? Okay, the option A is green bag, option B is yellow, option C is red, and option D is black. So which color-coded bag? Your time starts now. Yes, and your answer is yellow. Okay, not red, not to be confused. So the last question here is 3.5. It is raised IOP with 180-degree apposition between the peripheral iris and the posterior trabecular meshwork qualifies as which of the following? Option A is primary angle closure suspect. Option B is primary angle closure. Option C is primary angle closure glaucoma. And option D is chronic angle closure. Your time starts now. 180-degree apposition with raised IOP. Time is up. And the answer is angle closure because there's no optic nerve head defect. That's all.
Yes, ma'am.
From this side, yes.
Yeah, we end with the MCQ round 3. So now it's time for the rapid fire round. Yeah. So what are the rules? That in the rapid fire round, you will get 30 seconds and you'll have to answer 5 questions in that. First answer will be considered the valid answer. Even if it is wrong, we will take the first answer. And yes, in this round also, there is negative marking. Another thing is, in this rapid fire round, there are few images you have to directly it is like image based. You just to identify, it's a spotter, you identify where it correlates with. Or in some questions, it will be like the question is there and you will get a photograph of one of the scientists and you have to correlate with that. The answer, it will be correlating with that. So, shall we rapidly start with the teams now?
Yeah.
So, team 6.
We'll go randomly. So team 6, please walk in. Dr. Asta and Dr. Arun.
Yes, sir, we are here.
Okay. So you have to pick up the set.
So set 5.
Set 5. Let's move on.
So, are you ready?
Yes, ma'am.
Remember,
Be
you
closer
have
to the mic.
you have 30 seconds, and if you are not sure of the answer, please say pass, because otherwise you will exhaust your 30 seconds wondering over the first question itself. Best of luck.
Thank you.
So, your time starts now. So, corneal endothelium is decagonal. True or false?
False.
Bitemporal hemianopia localizes to
Chiasma,
Optic
optic
chiasma.
chiasma.
okay. Golden brown or greenish yellow ring at the corneoscleral limbus due to copper particles.
Kesa pleasure ring.
Capering.
What is the diagnosis?
Pass.
What is this?
Um,
Which implant is
my fourth one is pseudo exfoliation syndrome. Fifth is
Fifth is?
Okay,
your time
pass, ma'am. Pass.
Okay. So I mean, 4 answers were correct. The last one, it is the Argus 2 implant. So you get plus 40 for this round.
Thank you.
Okay, well played. Now, next team.
Team 6. Now it is team 4.
Team 4.
Spartans of South, na? Correct? Team
Set
4.
1. Set
Yes,
1,
sir.
sir. We'll take set 1.
Spartans of South, na?
Okay, set 1 you want. So are you ready?
Yes.
So let's start with the questions. So NMO.
Neuromyelitis optica.
What?
Neuromyelitis optica.
Yeah, but it is related to which disease?
Derrick's disease. Next.
Dispersive viscoelastic takes a longer time to wash out. True or false?
True.
Diagnosis?
Cystoid
Macular
macular
edema.
edema.
Test for metamorphopsia in central fields?
Amsler's.
Okay. And correlate this with the
Port
disease?
Weinstein. Sturge-Weber.
Okay. Great. So actually it is related to optic neuritis. The abbreviation was yeah. Okay. So plus 50 to you.
So you get
Okay.
plus 50. Very well played. Very well played. So now let's move on to team 10. Your choice. Team 10. Gaurav Pandey and Samvida. Gaurav Pandey. Team 10.
Yes, sir. Yes.
Please say yes,
Yes.
or no.
Okay.
Yes.
Set 7.
Okay.
Set 7.
So are you ready?
Yes, sir.
Okay. So your time starts now. Tight sutures can lead to with the rule astigmatism. True or false?
True.
RAPD is also called
Swinging flash. Pass.
22-year female underwent LASIK. Vision is 20/20. This is the SLE finding. Diagnosis. Curvilinear horizontal break in Desmith's membrane.
Hatch trial.
Diagnose.
Munson sign.
Munson sign with keratoconus.
So you gave 3 correct. So plus 30. The second is, it is Marcus gun pupil. And the third answer is the epithelial ingrowth. Well played.
So team 1, are you ready? Team 1. Team 1, RIO Trivandrum.
Yes, sir.
Yeah, come on. And Gopika. Yeah.
Which set?
Which
Set 8.
Set 8.
Set 8.
Okay.
8.
So are you ready?
Yes, sir. Yes, ma'am. Yes, sir.
So your time starts now. Temporal field defect is the commonest defect in POAG. True or false?
True. True.
CPEO is more common in males or females?
Females.
What is the inheritance?
Autosomal dominant.
This image is related to pupil abnormality and head injury.
Hutchinson's pupil. Next, Hutchinson's pupil.
Yeah.
Okay.
Diagnose this condition.
Calza. Dendritic.
Great. So the first answer is incorrect. That is a false statement. So you get plus 35 in this round.
So now it's time for us to move to team
Madam,
3.
we set. Bakila correct level.
What?
45. Madam, we set all.
They
all
said
four correct.
But first was wrong. You said true. The answer is false.
so 40 minus
Madam,
5 is 35.
50 minus 5.
No.
40 minus 5.
You got 5 questions, 4 you
40
answered
minus.
right, 1 was wrong, minus
Okay,
5.
okay, sir. Okay, sir.
Yeah.
So now
Team. Okay, let's move on to team 3. Team 3, Vidit and Zakir. Team 3.
Yes, sir. We're here.
Which set you want?
Set 3.
Team 3, set 3. Okay. So are you ready?
Yes, ma'am.
Okay. So your time starts now. Which disease is correlated with this? Emoji.
Optic neuritis.
DTG sign is seen in
Keratoconus.
copper intraocular foreign body can cause irreversibly flat ERG. True or false?
False.
Bent phacoemulsification tip used.
Kelman.
Huh? Yeah.
Kelman.
Diagnose?
Morning glory.
Very.
Morning glory.
Yes. So you answered all correct. So plus 50 to them.
Okay. Now team 8, are you there with us? Team 8, Archana and Priyanka. Ames Raipur.
Yes, sir.
Yeah, go ahead.
Which set?
Set 2.
Set 2. So are you ready?
Yes, ma'am.
Shall we start?
Yes, ma'am.
So your time starts now. RP can present without bone spicules in fundus. True or false?
True. Atypical.
Commonest organism causing post-op endophthalmitis according to EDS.
Procneobacterium.
Correlate with the sign.
Pass. Cherry red spot.
Okay. Erratic precipitate distributed in. Huh?
Heart's triangle.
Okay. Diagnose this.
Phase on 5. Temporal lobe lesion.
Wait, describe this finding.
Eye in the sky. Quadrantanopia.
Great. So you answered 4 correct and 1 is wrong. So plus 35. So the commonest organism is Staph aureus.
Team 5. Team 5, Oros plus 2. Yeah, Anusha and Ruhel, are you there?
Yes, sir.
Which set you want?
Set 3.
Set 3 is done better.
Set 3 is
Set 9.
set 9.
Okay. So are you ready?
Yes.
Team 5. So your time starts now. Esotropia leads to uncrossed diplopia. True or false?
True.
Brown syndrome leads to deficit of elevation in
Adduction.
diagnosis condition.
False.
Carotid artery dissection and mitosis.
Horner syndrome. Next.
Equaporin 4 antibody is seen in
Mog.
NMO.
Okay.
Atypical optic neuritis mog.
ठीक है.
Neuromyelitis optica.
Okay, let's see.
So the third answer was nevus of aorta and the 4 are correct. So you get plus 40.
Yes.
Okay, now Optica. Team 9, Optica, Pooja and Pratik.
Yes,
sir.
Which set?
Select the set.
6.
Okay. So team 9 is set 6. So are you ready?
Yes.
ma'am.
Please be closer to the mic. Your time starts now. How many plates are used in FM 100 test?
Pass.
What is 10 raised to power minus 15?
Femto.
Diagnose this.
BPS syndrome.
Junctional scotoma is named after Willebrand. True or false?
False.
Name the appearance.
Angiad streaks.
So first is 85 plates are there, and the last is wrong. It is the image of frosted branch angiitis. So it is plus 25 to you.
Well played. So now we have left with two teams. So Team Macula, that is Ames Raipur, Q and Shamila. Please select
Yes,
the
sir.
please select the set.
Set 11.
Set 11. So team 9. Yes. So are you ready?
Yes, ma'am.
Your time starts now. Enlarged blind spot is seen in.
Papilledema.
RF is used as a photosensitizer and is absorbed by the corneal stroma topically.
Pass.
Name the sign.
Pass.
Diagnose this.
Least nodules.
Neurofibromatosis. Pseudo inaberrant regeneration of third node.
Bone graft.
You want to attempt any?
Pass.
Okay. Time is up. You gave 3 correct answers. The second one is the collagen cross-linking, and the third is the beaten bronze appearance. Radio.
Okay. So, well, now only one team is left, Optal Nerds. So, please select the set. Dr. Wasabi, Dr. Shirisha.
4, ma'am. Set 4.
Okay. One minute.
1 minute. 1 minute. क्या बोल रहे हैं? Set 11 जो था ये.
1 minute. Just
One
hold
minute.
on. Yeah.
Which set you want?
4.
4. Okay.
So, before this, which team had played before you? Optal Nerds? Hello?
Yes,
Which
sir.
team had played just before you?
Team, can you tell?
Hello?
I don't remember, sir.
Teams,
no,
no,
I'm not
teams
asking you.
which
It was
played
Optic Up, sir.
Optic Cup, na?
Okay.
Correct.
Team 9.
Team 9 was it? Okay, fine.
Okay.
Now let's move on to the last team for this.
So are you ready?
Yes, ma'am.
Okay. So your time starts now. Both try are vertical folds. True or false?
True. True.
Against liquid sign is seen in.
Myasthenia gravis. Myasthenia.
Low grade uveitis with stellate KPs.
Fuchs. Fuchs.
Correlate this image with the subspecialty.
Next, pass. Pass, ma'am.
Diagnose this condition.
Melanoma. Hemangioma. Choroidal hemangioma.
Okay, let's see.
Your first answer was right. It is melanoma. So we take it right. The fourth answer, the subspecialty is, it is net, so it is retina. Okay. So plus 40.
Okay.
So I think we are through with all the teams.
Yeah.
So over to you, sir.
So friends,
Over.
we have through with the questioning part of it. Before we compute, it is time for us to invite all the mentors and the guests who have joined in for today's program. So I see Dr. Namrata ma'am. I invite all the guests, all the mentors to join in on the Zoom platform with us till we are computing the results. We also request, yes, Dr. Simon and all, we can see you. Dr. Chandrasekhar, welcome. Dr. Namrata ma'am, Dr. Santosh Onavar sir, thank you for being with us. All the quiz master, Dr. Kasturi ma'am, please. Yeah. Dr. Basak sir, Dr. Titial sir, you can please log in. Yeah. So we had a wonderful round of quizzing today. Dr. Partho, Dr. Uma ma'am, and Dr. Rashmin, you really made it. It was really interesting as well. Titial sir, thank you for being back with us. Thank you. I hope you enjoyed it, sir. How was the show? Did you see through it? Dr. Basak, sir, welcome. You have to unmute yourself, Titial sir.
No, it was very nice. I enjoyed all the sessions. I think for that multiple choice was good, enough time. For rapid fire, the time was little constrained.
Okay.
Yeah. But I think some
they had to
very well.
Thank you, sir. Basak, sir.
Yeah, interesting. I have listened almost 90% of it, and I echo with some round where you are telling what is describe this thing, then the time is actually short.
Okay. So that was Partho's round where we had an image-based question probably. We had to have a finite time, sir. Otherwise, also it becomes tough. And these kids are really faster than us. If you could see their performances, in spite of having the short time, most of them attempted within those 30 seconds. They are really faster than the application, probably, I
They're
believe.
best of the best. They have passed through all the rounds and come to finals. Obviously,
Correct.
all trained.
So we had about 300 plus teams. We started with the season with 300 plus teams. And these are the filtered one after 4 quarterfinals, 2 semifinals, and this. So they are the best of the brains, young brains from our country. And there are also, we have Dr. Namrata ma'am, your impression. She is also a quiz master, as well as Santosh sir. Some small piece of advice, as well as your impression about the quizzes.
No, I think, Prashant, it was absolutely seamless. It is not easy to do quiz, especially on a virtual platform where you have to coordinate so many things, the IT people, the sponsors, the platform itself, so many teams from so many different places. And I just thought it flowed like water. I mean, it was absolutely smooth and flawless. And many congratulations to you for taking it through last 3 years. And I have been seen this platform before also, but I think it is getting better and better. And today I thought it was at its zenith, at its best, where everything was effortless. I would like to congratulate all the 3 quiz masters who just did a brilliant job. Dr. Rashmin Gandhi, Dr. Uma Kulkarni, as well as Dr. Partho Pratim from Shankar Netralaya. And of course, the candidates need to be congratulated too. I think they think faster than the question which is put on, and their reflexes are absolutely sharp and are completely mind-blowing. And I'm sure the best team is going to win. So many congratulations to you, Prashant, to Shilpi, and to the entire team of the Big Q brain teasers that you do and have been doing for the last 3 years.
Yeah, thank you, madam, for those kind words. Santosh sir is smiling.
No, I think it was a wonderful quiz, Prashant. I think you are the big B of the big Q now.
No. See, all my credit goes to the quiz
I
master.
know you're great quiz master. I think Umar did a wonderful job. Rashmin, of course, he's so close to me. And of course, Partha is wonderful as usual. And the candidates are, of course, I mean, they're too good. They're just too good. They're very fast.
But I think we are all talking about the all the mentees, but we are forgetting to acknowledge the mentors who are behind, who have been a backbone to this. And today we also have those mentors, proud mentors with us. So we have Dr. Simon George, who was the mentor of Team RIO Trivandrum. Dr. Simon, where are you? So I
Good
think
evening.
back to them, or what should I do? Yes, Santosh sir, come in.
No, I think mentors
Yes,
are very important. I think they really trained all the mentees very well.
Yeah. So I think
I
more
don't know
important.
whether I don't know whether we trained them well or not, but they're giving the credit to us. So I think we are fortunate that way.
Yeah. No, but I see is the commitment on the part of the mentors at this hour, 9:30 on a Thursday, Wednesday evening. They are watching their mentees, also speaks about their commitment of all the mentors. So that is what I would congratulate. Dr. Simon, your comments, please. Your team really performed well, and it was amongst the top 10.
Yes, my team did well, and I must I full give credit to them, and because they had their limitations, they had to access from two different sites, and still they have done a very good job. And my role was just to motivate them to take part in the program. The knowledge and their performance was based on their own sincere efforts. And in fact, I would like to thank all the quizmasters for the excellent work which they have done in preparing questions, which ranged from simple questions to difficult questions. So there was a large variety of questions which really tested their knowledge. I will also congratulate all the participants, irrespective of the result today. All of you have done well in trying to use your knowledge to improve better. And my best wishes to all the teams, irrespective of the result. Thank you.
Thank you, Dr. Simon. But just for the sake of information of all the guests who are there, the team RIO had 2 participants who are in the last trimester. So we were not sure whether they would be able to participate in the finals. And look at their, persistence and their grit that they, in spite of being in the last trimester, they are with us and they played so fantastically well. So really, Dr. Simon, I'm really thankful to you for motivating them at this hour and taking care of their health and helping them out. Very well. As well, we have Dr. Chandrasekhar from Arvind Eye Hospital, who is also a good, very renowned quiz master. He always fields his teams from Arvind, and most of the times, they are amongst the finalists. Last 3 seasons, I have not seen a season where one of his teams from Arvind is not there. Dr. Chandrasekhar.
So thank you so much for the good words, sir. But at the outset, I must say all the 10 teams here deserve to be there. The way they answered, it was absolutely fantastic, and the time was very short. And the whole design of the team, the quiz designed by you and Shilpi has been fantastic, and quiz masters have been outstanding. And it is an honor to be here with our teams. They did a very good job. We trained them, but they have to pick it up, and they did very well. And I must thank you once again for inviting me to be here for the finals. Thank you so much, sir.
Dr. Prabhakar Sastry is the mentor of team Optam Nerds, that is from Vizag. Yes, sir. Dr. Sastry, sir.
Sir, good evening, sir. All of you, good evening. Good evening to the quiz masters and the mentors, Dr. Jeevan, Dr. Santosh, Dr. Namrata, each and every, even the participant. And it is my privilege to be one of the mentor of the Vizag Regional Institute of Ophthalmic team. It goes by the name the Nerds Ophthalmic Reds. And in fact, we train, as somebody was telling, we don't know whether we are training them well or not, but they're bringing good name to our institute. That much I can say. And thank you for introducing me to the team and all the members, Dr. Prashant.
Thank you, Dr. Prabhakar Sastry, sir, for being so humble and so giving all the credits to your student. Definitely, it is not without your guidance that the students can perform so well. Thank you for being with us. Stay for the final ceremony, sir. Dr. Kasturi, from
Hello.
Madam, we wanted at least one season where a team from JIPMER should not be there, but you do not. You look into it that every time JIPMER has to have a team into the finals. What do you do differently for that? That every time we have your team.
Yes, sir. Thank you, sir. First of all, hats off to you.
No, in Hindi we say, "कौन से चक्की का आटा खिलाते हो आपके वहाँ के students को?" All 3 seasons we had your team in the last,
Yes, sir. Actually, we are very fortunate to be there in all the seasons of this big quizzing program. Actually, the students themselves are very humble, sincere, and hardworking, and they are putting up a big effort to come up to this level. And just getting qualified to the finals is a big victory to them. After that, whether they get the prize or not is a different game all over. And at JIPMER, actually, we always encourage them to participate in all quizzes, whether it's at the regional level or at various conferences or the national level. And the last few years, we also have been trying to conduct many Kahoot quizzes on various specialty days or awareness weeks, like Glaucoma Awareness Week or the World Sight Day. So they have been into the quizzing quite often. Maybe that also is helping from our side. But I also give total credit to them only, sir. I think they have been really studious and sincere in their efforts.
Thank you. Thank you, Dr. Nirupama ma'am. Dr. Siddharthan, are you there with us? Professor Somen Mishra? Dr. Siddharth? Yeah, Siddharth.
Yes, sir.
So a young mentor.
No.
You almost look a participant. So it's difficult to accept that you are a mentor. You did so well. Your team did it.
Yes, thank you. I think again, I had no role in this, sir. I think the only reason they chose me as mentor is they didn't want to be mentored. So, otherwise, I really enjoyed the quiz, sir. Thank you very much.
Thank you, Dr. Siddharth. Professor Mishra from our AIMS Raipur. We are missing Professor Mishra, otherwise he's a constant face all across every episode he was with us. Dr. Madhuri from AIMS Raipur. Dr. Vivek Chaitanya. Deepak Mishra. Dr. Deepak. Vivek Chaitanya, sir. Yeah, please do log in. Yeah, get your video on.
Good evening, sir. Thank you, sir, for the opportunity. The full credit goes to the quiz participants only from our hospital, sir. And thank you for organizing this quiz, sir. It is a very well organized program. Actually, the mentor's job was just to motivate them. The actual credit goes to the students who need to study properly and give the answers. So thank you, sir, for the participation. Thank you, sir, for the opportunity.
Thank you, Dr. Vivek, for mentoring your team so well and getting them into the finals. Dr. Deepak, where are you? We are missing you. We had a team from BHU who went into top 10. Okay, fine. So just let me check what is the status of the score. We should be ready. 1 minute, please. Till then. So we are just with the last part of the computation and just get the prize. So we have a lot of prizes today and this will be distributed by the, okay, let's move on to the prizes. Okay, so let us announce for the, I think teams, let us move from. So teams, all of you can join us on the Zoom platform, please. Please log in. One minute. Yeah. So are you all excited?
Yes, sir. Yes.
Yes, you can speak. Now you can get your, huh? So what do you think? Who should be the amongst the what should be the order? Who is going to top the today's show? Today's episode. Anyone? Any guesses? There are some surprise prizes for some right guesses as well, like this. Hmm? Okay. So let us move from bottom to top. So on today, on position number 10 was Team Macula. So Team Macula, we have prize money for from 6 to 1. Okay. And for team 7 to 10, we are having a gift vouchers, which will be delivered to you at your place. So team 10, that is Team Macula. Please come on. We have, that is a team from AIMS Raipur, Dr. Sharmila and Q Mandal. Please come in.
Yes,
Where
yes,
are
sir.
you?
Yes, sir.
So congratulations. And I would request Dr. Somin Mishra sir is missing. So Dr. Santosh Onavar, just congratulate them and virtually you can hand over a gift on a prize to them, which will be delivered subsequently. Santosh sir, you can interact with them and congratulate them.
Right. Congratulations, all the best. You did really well.
Thank you, sir.
So playing is well played. Congratulations. Then now let's see who is on the team at position number 9, and it is Team Friends, and the Team Friends is from
BHU.
BHU Varanasi. So Dr. Gaurav Pandey, Dr. Samvida Pariyar.
Thank you, sir.
Thank you, sir.
Thank you, sir.
So where is Deepak? We are missing your mentor.
He was there for some time. I think he's busy.
Okay. Best
Why
of
that
luck.
name, friends?
As a common interest in the Friends series.
Okay.
Congratulations. And
Thank you,
now let's move on to team number 8 on today's episode was Optal Nerds. And Optal Nerds is from Team Vizag. It's from RIO Vizag. So congratulations. And I request Dr. Namrata ma'am to congratulate them on behalf of our team.
So many congratulations to Optal Nerds. I really like the term nerds.
What do you mean by nerds? Yeah.
Oh, I like nerds because that means they are only studying. So that's a good this thing to have as a good title to have as a team because it just shows your commitment. So many congratulations and all the best in future.
Thank you. Thank you.
Thank you. Very
And
well.
this is my I think this is Dr. Prabhakar Shastri's train.
Correct.
So
Yes, sir,
my
Namrata.
we are
Yeah.
batchmates. So so it is again my pleasure to congratulate them.
Thank you.
With their mentor, Dr. Prabhakar Shastri.
Thank you, Namrata.
Okay. So now let's move on to team number 7 is Oro Stars 2. So Oro Stars 2, that was Dr. D. Chandrasekhar's mentor team, Dr. Anusha and Dr. Ruhel. Where are you?
Yeah.
So can I request Dr. Namrata ma'am to have a small chat and encouraging words for these guys?
So congratulations again. And I don't know why the name Oro Stars came. So you have to explain that.
Oro,
Yes.
Aravind.
You have to put your audio on before you do that. Oro Stars.
We are from Arvind.
Yeah.
I
Okay.
hospital and everything in
That's
Arvind is
right.
named
That's
after Oro.
Oro, so.
And
Not Arusha.
2.0 because there was another team before us who won Big Q.
Okay, good.
Okay. And Dr. G. Chandrasekhar is with them. He was the mentor for this team, ma'am. Rather, he's the mentor for all the teams which are fielded. But for this one, we had to have different mentors. So
Yeah.
that is very well played. So,
Thank you, sir.
okay. On team number 6, and they get a prize money of rupees 5,000 rupees, a gift voucher. And can I request Dr. Santosh Honavar to congratulate them and hand over virtually the gift voucher? Optica. Team Optica. And that is
Team 9 at the 6th position.
Yeah, Pooja Patil and Pratik.
Yes, sir. Thank you, sir. Where are you from, Pooja and Pratik?
Shankar Eye Hospital, Coimbatore.
Coimbatore. Congratulations, you did very well.
Thank you, sir.
So your mentor was there with us. We need to congratulate him as well. He will also get a gift voucher of 15,000 rupees. Okay. So now let's move on to team number 5. And team number 5 is RIO Trivandrum. So Dr. Gopika and Dr. Anu Philip. And the mentor, a proud mentor, is Dr. Simon. Yeah, where are you? Madam?
Hello.
Would expect
Good evening,
you
sir.
to- Yeah,
Good evening.
Madam, Namrata ma'am. These
Yeah.
are the girls in the last trimester. I don't know whether I should speak it. And they did it.
Hats off to both of you.
Thank you, ma'am.
I wish you all the best.
Thank you, ma'am.
And I salute your courage, your commitment, your dedication. And I'm sure that this is going to go a long way in your journey onwards in the future also, both professionally and personally. So many congratulations.
I was
Thank
just
you.
wondering loud, ma'am. Namrata ma'am, I was wondering loud. Will their kids be a ophthalmologist? Because I heard in Mahabharata, Arjun.
Yeah.
They will be doing quizzes in future.
Okay. So finally, Dr. We have Deepak Mishra here, whose team played. Where were you missing, Mentor Sahab?
Sir,
Yeah.
I was on another call. Meanwhile, I missed the quiz.
So your team did well. Your team was on team position number 9. Congratulations for being with mentoring your team so well and being a finalist.
Thank you, sir. Best part, I always told them that you played. That is the playing a game or participating anything is much more important than winning.
Yeah.
If they play, that is the best part. And I'm happy that they performed well throughout the series.
They not only played well, they were amongst the top 10 teams in amongst the team 300 teams which played across. So you should be proud as a mentor, Deepak, I believe. It's
Yes,
not
sir.
just playing, they really performed well.
Yes, sir.
Congratulations.
Thank
So
you, sir.
now at team number 4, yes. At position number 4 was Team Tulip, and Team Tulip is from AIMS Raipur. Dr. Archana Singh is their mentor. So, no, sorry, Dr. Madhuri is their mentor. Dr. Archana and Dr. Priyanka. Where are you? Archana,
Yes, sir.
can I request Dr. Santosh sir to do the honors?
Congratulations, Archana and Priyanka. Very
Thank
well
you.
played. Very well played.
Thank you, sir. Thank you, sir.
So, who was grooming you? This is second year we are seeing from the AIMS Raipur, we consistently a team from there. Who helps you out with all learning and all this part, especially encouraging you for the quiz and getting you into the finals?
Sir, I think the kind of patients and the kind of faculty we have, that is the inspiration that we study. And yes, sir.
Good. Keep getting inspired and work harder. Okay, well played. And you will be getting your gift vouchers delivered at your place. Thank you once more. Okay. So the second runner-up for the today's finals is Asta and Arun. So Asta and Arun, where are you? So that is from JIPMA.
Thank you, sir.
So Kasturi ma'am, again, some bigger smile for you.
Yes, definitely. I'm very happy for both of them. And both the team members are a bit cool-headed, so I think that really helped them to come up to this level. And a special treat to them from my side also, sir, for winning third today.
So Dr. Titial sir, you have to do that honors for this second runner-up to Dr. Kasturi ma'am as well as the team members. Where are your team members? Come on.
Sir, we are here.
Yes.
It is, absolutely, really pleasure to be, in this particular quiz show. Wonderful. And Nirupama done really well to, train these two young students to be in a top 3. I think all the 10 teams are winners, because if you come from 300 teams to number 10, that's actually you're a winner, And maybe they are so fast and they are aware of these things. Maybe I see in the entire journey of education, teaching, happening, medical side has gone into MCQs only. So they have to be as fast in MCQs. But I think that these quizzes, which is happening across the country, are not only the quiz, they are basically the knowledge testing of our students also. So they are really knowledgeable, and I like to congratulate the entire team from Pondicherry, Jipmer, and do well, and hope to see you again very, very soon.
Thank you, sir.
Congratulations.
Thank you, sir.
Very well said. So now we are only left with 2 teams, that is Spartans of South and Hassel Henley Body. So one team is from Arvind Eye Hospital, Coimbatore, and one team is from RP Center, Delhi. So whom do you think is going to be the winner? Chinmay, Vidit, what do you think?
Hard to guess, sir. I think it's Hassel and everybody's for sure. They have been amazing throughout the quiz.
Yeah, they have been too good.
So, Chinmay, you think RP Center did well?
Yeah, they were good.
We had a slow start, actually. Today we had a slow start.
So, RPC, what do you think? You are going to be number 2 or 1?
Hard to guess because we had a slow start today. So we missed 2 questions. Otherwise, we would have been.
What does your mentor think? Yeah, let me ask her.
No, I was, thinking from 10, 9, 8, I'm noting down. I thought there would be 10 or 9 or 8 or 7. And then I think any of the team wins. It is like even Dr. Tityalsa said, that first, if you're in 1 to 10, you are, there and you are good enough. So it really doesn't matter. And I didn't know that Vidit and Zakir Hussain were so capable, but I'm happy to see them doing well. Vidit is my thesis candidate. He did thesis with me on bioengineered corneas. And Zakir, of course, has been with us, both with me and Dr. Tityal as well.
Okay.
So all the best. I think whosoever wins, it doesn't matter. But
So let's see. So the first runner-up for finals of this third season of Big Q is team from Arola, Arvind Eye Hospital, Coimbatore, Dr. Chinmay and Dr. Chinmay and Dr. Kritin Shah. And naturally, the winners are going to be from RP Center. Congratulations.
Thank
So,
you. Thank you so Actually, you were not expecting.
So, Doctor, I
We
think
were also not expecting, don't worry. I was not expecting.
ask Dr. Santosh Honavar to do the honors for Arvind, and naturally, Dr. Titial sir to do the honors for the winners. Dr. Santosh first.
Congratulations. You are really, really very good. I was very impressed the way you answered, very confident, very quick, very, very quick, actually. Really did very well. I think you must have missed by a mark also.
Yeah, it's just a very close tie-up. In fact, it was difficult for us to, but we had to declare the announcement. We had to have someone up or down. Well played, Chinmay. Very
Thank
well.
you, sir. Thank you, sir.
Congratulations. Very well said. Kritin as well as Chinmay.
Thank
And
you, sir.
sir, आप ही की टीम है, आप ही बच्चों को बोलिए क्या बोलना है, आपको कैसे congratulate करना है.
No, first of all, we normally ask our students, what has been your achievement in your, educational system or institution, which makes you feel proud or which makes your, teachers proud. Today, I'm really feeling very, very proud that, our people have done so well. And maybe mentoring has been good. Namrata always been one of the topmost person in this world. So naturally, some genetics will seep into our students also. I really feel privileged to be sitting here, and I thought also what Namrata said. They started very slow in the first few sessions, but subsequently they did very well in the last 1 or 2 rounds. Again, congratulations to Team RP Center. And
Thank you, sir.
Flag always high,
Yes,
and
thank you,
make
sir.
sure that we always be there so that other people also take in account that it's not only the institution, it is the hard work of yourself, which is also very important.
Thank
And
you, sir.
actually win is your hard work and your knowledge. Great work. Thank you again for making us feel so
Thank you,
good.
sir. Thank you so much.
Yeah.
Sir, you forgot to congratulate the mentor.
Assets in between, and Namrata, always there, and we all are students to her.
No, sir.
We
It's
learn
not
so many
like
things from each other,
So I think before we just wind up the final thing, the private practitioner categories prizes also we need to announce. Sir, we have been very lucky. There have been people who are beyond this. They participate regularly in our rounds, and they also fight neck to neck with these young people. So let us announce the prizes of the in the private practitioner category, and these are the phone numbers 83680-82207, 93150, 99559, 94451, 43043. Yeah, so these are the winners in the private practitioner category. Congratulations to you. We will be the Microvision team will be coming back to you with the necessary prize money.
नाम भी तो होंगे यार.
हाँ जी सर, वो नाम नंबर से काउंट पे आता है ना, तो उसके कारण then we have to we ask them to come back to us, sir. Yeah.
Sai, anyone from the last
Private practitioner category, anyone has logged in? Sai?
No.
Not yet logged in. But we are very fortunate, sir, ki every time people who are into the private practice are regularly participating and they are winning the prizes.
That's great.
Sir, actually, last time I participated as private practitioner, sir, because ma'am told in semi-finals we have to participate as private practitioner.
Okay, we'll look into. So you were the amongst those?
Yes, second.
Okay. Congratulations. So
very nice.
Very good. Very well played. So we will be delivering you the micro people will be delivering you the prize money. So it's time for us to say goodbye for this season. We are really thankful once more to all the quiz masters across. We are a group of about 35, 40, 50 quiz masters who have created this wonderful season 3 for us. Everyone in fact, me and Dr. Shilpi, our job is just to collate and get this all people together. But the hard work is done by the quiz masters who have been toiling hard and creating wonderful questions, which are not only helping us in learning, but also equally informative as well as interesting and something they help us in doing. So my sincere most thanks to all the quiz masters. I think from Dr. So I see a small message in the chat box where I see Dr. Shrishti Kullar she was the last time's quiz third quiz winner. Are you there with us on the?
Yeah, she's joined.
She just now joined. So let me congratulate her. Yeah, Dr. Shrishti.
Sir.
Where are you? Just introduce yourself to the.
Sir, I am currently serving in the army, sir. I'm at Armed Forces Medical College, Pune. And
Okay.
sir, Dr. Tanmay, who has been winning this quiz many times, is my mentor actually. And he keeps pushing me to participate in the quiz. I'm so lucky that on the final day, I got the opportunity to become the third winner. It's my
Okay,
pleasure to meet you
congratulations.
on this platform, sir.
Thank you. Thank you for being with us and participating. Congratulations. Okay.
Thank you, sir.
Thank you.
Thank you.
Thank you. So, friends, it's now it's a slightly a sad moment, a sullen moment for us from Team Brain Teasers team because
Shrishti is the same Shrishti from AFMC Pune.
yeah.
Yes.
So she was the one who led all women
Republic Day parent.
FMC contingent. You're saying Shrishti, no?
Yes, ma'am. Good evening, ma'am.
Congratulations again for that
Thank you,
one.
ma'am.
So she was the one who led all the women AFMC contingent in the Republic Day parade.
Okay. Okay.
Thank you.
Oh, congratulations. We are so proud of you, Dr. Shrishti.
Thank you, sir.
So, anyone from Microvision team would like to speak something? Navneet or Ashok?
Yes, sir. I'm there already.
Yeah.
Thanks to the entire team of doctors who participated in this whole program. Thanks to all the mentors and the special guests today in the platform, and a special thanks to Prashant sir, you and Shilpi madam, for making this whole event a very grand success and a very interactive. And I think when we interact with the team members across India, we found that many of the young doctors, they wait for this program to start and they wanted to participate in that. Microvision is always there for such educational and entertainment programs ahead as well. And once again, we are privileged to be a part of this event, sir. Thanks to all of you, sir. Thanks a lot.
Thank you, Navneet.
Congratulations to all the winners. Yes.
Okay. So thank you all the participants who made this season 3 so interesting, all the quiz masters who made it, and today's quiz masters, special mention to Dr. Uma ma'am, Dr. Partho and Dr. Ashmin for making it so interesting and so engaging, and all the quiz masters. Also, my special thanks goes to all the guests who had come, Dr. Tityal sir, Dr. Samar Basak, Dr. Namrata ma'am, Santosh sir, for being with us to encourage our own students, and all the mentors who pushed their students and got them into this platform. Thank you once more. So it is time for us to say goodbye from this season 3. We will be initiating the season 4 somewhere in the month of October. So keep looking forward. Till then, it's time for us to say bye-bye from our team Big Q as well as Brain Teasers. Bye-bye and best of luck.
Thank you so much, sir. All
Bye.
the best.
Thank you.
so much.
Bye.
Thank
Good night. Good night.
you. Good night. Thank you, sir.
Thank you.